Off the top at 5:30, the latest coronavirus numbers in Idaho. The state just reporting more than 1,600 new cases, bringing our pandemic total to over 224,000. 8 more deaths were also reported today.
What really is the most extreme healthcare delivery situation the state of Idaho has ever experienced. Today,
a grim warning tonight from local healthcare leaders. They are concerned about the increase in COVID cases, the current staffing challenges, and the reality they could soon have to make tough decisions about who gets what care. Healthcare leaders made clear the overwhelming majority of patients they are seeing in the hospitals right now do not have the COVID-19 vaccination.
CBS 2's Marcos Guadarrama listened to today's announcement and now joins us live here in studio with more on what was said.
Healthcare leaders say most of the patients dealing with the severe symptoms don't have their vaccination. They warn it's creating strain on the healthcare system across the state.
it's time to expect that things are going to be different when you need health care for the short-term foreseeable future. It's not going to be as quick, and there's going to be a prioritization based on how sick you are. You should be prepared to take care of yourself at home when possible.
Dr. Stephen NEMERSON from St. ALPHONSUS says the current fourth surge of COVID-19 is the worst the state has experienced. He said test positivity rates are well over 9%. Dr. NEMERSON says St. ALPHONSUS is now using parts of its healthcare facilities that weren't designed for patient care. They're making these decisions out of necessity. All three healthcare leaders said the increase in COVID is having a significant impact on their employees.
We all should be with our healthcare workers who are stepping up in crazy, ridiculous circumstances to provide the care they need for their community. It is inspiring, and people are going well beyond the things that they have traditionally done or would have expected to do. We're putting people in positions that they ordinarily wouldn't have been doing.
Dr. Frank Johnson of St. Luke's says more than half of the adult patients in their care have COVID-19. He says it makes it impossible for the hospitals to provide surgeries like knee and hip replacements, along with back surgeries. As for his staff, Dr. Johnson said 92% have complied with the COVID-19 vaccine mandate or have an approved waiver for religious or health reasons. He says his teams are excited and that the vaccine can save lives.
We continue to lose people who didn't have to die. We continue to comfort families after a death that didn't have to happen. And there is heartache and there is pain, and there are folks who are suffering who don't need to suffer.
Dr. Richard Augustus of West Valley Medical Center says they are getting calls from Oregon and Washington requesting for patients to be transferred here. He says his hospital is taking creative approaches to treating patients, something they will continue to do. Dr. Augustus says people should be doing things to protect each other, like getting their vaccine and wearing a mask, all things that will help free up hospital rooms. On the call today, doctors say emergency room wait times are longer than they have been because of COVID patients. Live in the studio, Marcos Guadarrama, CBS 2 News.